Effect of doula on intra- and postpartum complications in Middle Eastern mothers. Background. Right now, Middle Eastern countries such as Iran, Iraq, Palestine, and in Palestine, birthing mothers face serious mistreatment and abuse during labor, which leads to complications during labor such as more pain and anxiety, and lasting effects after labor such as PTSD. This is detrimental to the overall health of the mother and baby. The mistreatment, abuse, and neglect largely comes from social, cultural, and institutional factors like patriarchal attitude towards women, limited access to health services, inadequate training and supervision of healthcare providers. Studies have found that the support of a doula during labor can help greatly in reducing pain, anxiety, abuse, and instances of PTSD after labor. In a qualitative study conducted using interviews and surveys of 6 Palestinian women, research discovered that the cause of the mistreatment of birth-giving mothers is largely also due to scarcity of childbirthing facilities, limitations in staff, and resources. And in Iran, the current practice is that postpartum women often develop PTSD as a direct result of the abuse that they suffered during labor. The clinical problem is that first-time birth-giving mothers in Middle Eastern countries have increased anxiety and pain during labor. They also face mistreatment, disrespect in regards to their patient autonomy. A possible solution to help calm the women and reduce pain and anxiety is by having a doula for support during labor. Furthermore, women in Middle Eastern countries, especially Iran, have complex issues after childbirth. Having a doula can help decrease any complications that arise. Complications such as verbal abuse, lack of respect for patient autonomy, or the mom developing PTSD postpartum because of their childbirth experience. Labor is already an anxiety-inducing stressful event for women. A doula may help alleviate some of the anxiety involved. PICO question. P. Population. Nulliparous Middle Eastern women that experience increased anxiety during childbirth. I. The presence of a doula during childbirth. C. Comparison, compared to anxiety levels during childbirth without the support of a doula. O. Outcome. Patients experience less anxiety during labor. That is the desired outcome. Now, to conduct my research, I had multiple search strategies that I utilized. Firstly, the database I used was CINAHL, C-I-N-A-H-L. I used multiple search terms, diverse search terms, to gather many different articles. Some of the search terms that I use are use of doula in Middle East, doula plus mistreatment, childbirth plus mistreatment in Middle East, doula plus childbirth, doula plus labor and anxiety, and mistreatment plus childbirth and Middle East. Evidence. According to multiple studies, doula support during labor resulted in less C-section births, it reduced incidences of uterine ruptures, improved the mother's quality of life, and it led to lower mortality rates in the moms. This indicates that doula support led to decreased complications during childbirth. Furthermore, 74.7% of Iranian mothers without doula care reported experiencing abuse and disrespect, and as a result, their average PTSD score was 7.32, as compared to women who had doula support and did not experience any abuse during their labor because they had a doula, and the doula stood up for them and advocated for their patient. So the average PTSD score for these women with doulas was 1. Now, there is a significant difference between these PTSD scores, a difference more than 6 numbers. This indicates and largely points to the fact that having a doula during your childbirth can be very helpful to you. Moreover, women that have doula support during labor reported experiencing less pain and anxiety as a direct result of the doula's care and presence as compared to women without doula care. For example, in the study conducted, birthing mothers without doula support, their average anxiety scores during labor was 58. Meanwhile, birthing mothers with doula support, their average anxiety scores intrapartum, meaning during labor, was 48. Again, the difference in numbers is significant. Here, there is a 10-point difference, all due to having a doula can cause you to experience less pain, less anxiety during your childbirth, if you are Middle Eastern women. Throughout my research, many articles pointed to many different themes and improvements that can be done in practice. One such theme is they all drive to improve maternal care in hospitals and birthing facilities in Middle Eastern countries. Most of the articles call to address and rectify the limitations that the Middle East experiences in resources and staffing in these childbirthing facilities in order to provide good quality and respectful care. Additionally, articles suggest that HCPs should start informing birthing mothers about their rights. That way the mothers can stand up for themselves and know what their rights are and know when they are being disrespected. Additionally, there is a need for healthcare providers and staff to address and recognize harmful, disrespectful, and abusive childbirth practices, and they should aim to improve mental health outcomes of postpartum mothers. Lastly, there should be an integration of traditional midwifery and doula positions into the standard hospital care for labor and delivery practices in the Middle East in order to provide high-quality, patient-centered care. Shifting away from traditional Middle Eastern midwifery practices has caused a negative outcome for moms and babies, such as increased medical interventions during labor. Labor is now more medicalized, and there is more pharmacological methods used in labor as opposed to traditional Middle Eastern childbirthing practices, and lower quality of care and less respect for patient autonomy. So one article suggested heavily that Middle Eastern countries should bring back midwifery practices, doula practices, because they cause higher quality of care for the mother and reduce negative complications, intra and postpartum for women. These are my sources. Thank you.